610 WTVN.
Very pleased to welcome Dr. Murray Cohen to the live line. Dr. Murray Cohen is an infectious disease expert, 20 years with the CDC. I bet that was a pretty interesting time, right, Doctor?
Yeah, I had a fabulous career.
Yeah, it's. I think about, being, I guess when you talk about the CDC and medicine, that's kind of like the epicenter. That's kind of like where all the big decisions are made and lots of information coming through there. In your time there, was there anything at all like what we're going through now?
Kind of the minor league version. We thought it was major league at the time. Yeah, we had a big hantavirus outbreak out in the Four Corners area of the United States. That was an emerging pathogen we'd never seen before, really dangerous respiratory disease. I think that was in 1992. Okay. 97, we had the Hong Kong flu. The bugs are winning. They keep reminding us of that.
Yeah, when you say that, I kind of, there's a little piece of my stomach that falls. I do a fair bit of reading. I grew up in a house, my mom was a nurse, so, medicine and medical stuff has always kind of been a bit of a backdrop for me. But, you read about hospitals and superbugs, staph infections, and we keep coming up with meaner and tougher antibiotics and different stuff to put in people to kind of fight these things off. But like you say, the bugs are winning. So, as we're sitting here, May 11th, 2020, and the bugs are winning, what do we do? Can you really totally protect yourself from this stuff? Is washing your hands and wearing a mask ultimately going to be enough?
Well, as an individual, you have to respond as best you can. So we can talk about that. Yeah, definitely the hand washing and wearing a face mask and social distancing. These things are working on an individual level, on a population level, on a countrywide level. The real question is, why do we keep fighting the last war instead of preparing for the next war? We really have a lack of imagination and political will to be preparing for these things. We know they're going to happen. We absolutely know they're going to happen. We don't know exactly when, where, or what. I don't think any of us foresaw exactly this kind of a pandemic with this voracious of a virus, maybe in our nightmares. But we've sure got it now, and we've got it for good.
Yeah. So is that, Doctor, is that an infrastructure thing? Is it, we got to make sure that each state has an appropriate number of masks, and face shields, PPE, to make sure if it gets bad, all of our medical people can do their job, do it safely? Or is it really the medical research side? Is it, knowing another bug, as you put it, is going to come, so let's just keep working on it and staffing up and making sure that whatever variety it is, we're ready for it?
Well, it's really a question of keeping a robust public health infrastructure. We tend to, when there's a major outbreak or a really horrible flu, spend a lot of money and, wring our hands and gin up a public health response for the moment. And then we cut the budgets. And then we just kind of do nothing and wait until another one hits. That's not very smart. The bugs are smarter than that. What we need is to invest in a pretty regular, robust public health infrastructure. It's not just the PPE. It's having local health departments that are staffed with people trained in contact tracing, tried and true public health measure. We did something like this really back kind of at the beginning of the invention of antibiotics. It's back in the Eisenhower administration when syphilis was a real scourge, coming in after World War II. And he really built public health infrastructure all over the country and kind of a war on sexually transmitted diseases. That was pretty effective. We dismantled it after that, and then it's been up and down, up and down, up and down ever since.
So that sounds like that kind of thing would almost be public education as well. It's like, we don't know when, but the next bug is going to come through, and here are the things that you can do every day that kind of insulate you from that.
Yeah, my wife and I joked that, America seems to have a deficiency in level of science education. But what I would say is that the scientific enterprise is held in about as low esteem now as it ever has been. And that's sad. Public health is not rocket science. Basic hygiene, the stuff your mother taught you to do, just needs to be a way of life. one of the things that I hope will be a positive outcome of this pandemic is I think people are going to start paying much better attention to hand hygiene, which has always been a problem and is a big part of the problem in the development, as you mentioned, of antimicrobial resistant bugs that just keep getting stronger and stronger and stronger.
Yeah.
And just the simple, basic hand hygiene goes a long way. There's another thing, I know that you've been talking about it being so cold there. Another thing that people don't put a lot of attention to, but it turns out with viral infections, you really need to stay well hydrated because they really like cold, dry air, and they like, dry lung tissue. So if you just drink a lot of water, a lot of fluids, a lot of warm fluids, and stay hydrated, then you're basically giving your immune system a bit of a head start when they, in fact, are exposed to a virus.
Yeah, we've talked to doctors that suggest that humid air would also be very beneficial because it makes all the droplets heavier. They fall out of the air quicker. But plus what you're saying there, drier lung, it's more receptive. So the moisture you can make the air, the more hydrated you make the human body, the better chance you have of fighting this thing off.
That's absolutely correct.
Brilliant. One of the things, too, we're talking Dr. Murray Cohen, by the way. He's an infectious disease expert, 20 years with the CDC. One of the things in your studies is that the human eye actually is kind of a conduit. Walk me through, how did we determine that, and what can I do to make sure that my eyes don't allow the coronavirus in?
Well, first, before people get panicky, this isn't some new revelation, a new risk to be worrying a whole lot about. It's a risk factor that exists, and we know that, perhaps 1% of the COVID-19 infections are caused by eye exposure. But you still need to be aware of the risk and the danger. The conjunctiva of the eye, the pink tissue inside your eyelids that surrounds the eyeball, is a mucous membrane, just the same as lines your nasal passages and lines your throat. And we know that these viruses are able to enter the body through these mucous membranes. So the eye has always been a problem for any of these respiratory viruses, including influenza. It so happens that with this COVID-19, when it's a bad infection in the lungs, well, it's a bad infection in the eye as well. And ophthalmologists are reporting a rise in kind of a COVID-19 pink eye, which is painful, but it's also very communicable. So that's why you see the healthcare providers, in all of the news pictures wearing some kind of a face shield or goggles along with their face masks.
Right.
This isn't so common that all of us, walking through grocery stores and, being in public and being in school need to also wear face masks. But the problem is, this is what the hand hygiene is about. Most of the way that eye exposure occurs, other than in a hospital where you've got high concentrations of virus and a lot of sick people, but out in the public, it occurs when you touch a surface that has the virus on it, and then you touch your face, touch your eye.
Right.
And you're basically inoculating yourself. There's also a lot of commentary in the medical literature now about people who wear contact lenses and whether that's a higher risk of getting the infection through the eye, than if you don't wear contact lenses. And I haven't seen any particular studies that show that, other than people who wear contact lenses tend to touch their eyes a lot more often.
Right.
Just so. It's certainly a good practice to switch back to glasses while we're going through this.
There you go. It's just, I remember, being in college taking speech class, and, for those kids that would get up and give a speech and, would land on every so often, the professor is like, look, you got to hear that and you got to learn not to say it. And, when you get called on it, eventually, it kind of rings a little bell in your head, and then you stop doing it. It's the same thing for touching your face. I mean, an awful lot of people, doctor, have that face mask on. You're not used to wearing it. So what happens is you're constantly wanting to adjust it. It tickles your cheek, it tickles your nose, so you're up there reaching for it. It's like, you got to stop doing that. So in your brain, you have to set off some kind of alarm. It's like, once that mask is on, leave it alone and don't touch your face.
That's exactly right.
It's great stuff. Dr. Murray Cohen, thank you very much for the visit and the time. Fascinating for sure. Dr. Cohen, an infectious disease expert, spent 20 years with the CDC. So there's some information you can take